Hello, everyone. So many people have been affected by cancer, either themselves or maybe they know a family or friend, family member or friend that have been affected. And cancer is the second leading cause of death worldwide after heart disease. And according to the American Cancer Society, at least 42% of newly diagnosed cancers in the US, which is over 800,000 cases, are potentially avoidable. And so today I want to talk about what we can do to lower our risk of cancer. So you're listening to Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a family medicine and lifestyle medicine doctor, and I own a unique medical practice called In Touch Primary Care in Sugar Land, Texas. We offer stress-free health care with direct access to the doctor so that people can get the care they need without the typical inconveniences and delays that often occur in the healthcare system. Our website is www.intouchprimarycare.com. And if you're in Texas, you can actually schedule a free 15-minute consultation while on the website. All right, so let's get into it. What is cancer? Well, cancer is a group of diseases which is characterized by uncontrolled growth and spread of abnormal cells. And it can result in death if it's not treated. So abnormal cells start to grow uncontrollably and they spread throughout the body, causing problems. And there are actually about 200 types of cancer. They're typically grouped by where they start in the body. So, for example, breast cancer starts in the breast, lung cancer starts in the lungs, but can spread to other body parts. And few of them are relatively common. So, according to the NIH, breast cancer is the most common type of cancer, followed by prostate cancer, then lung cancer, then colon cancer. So those are the four most common types of cancer. But again, there are many, many different types. So 42% of newly diagnosed cancers in the US can be avoidable. And that's because about 19% of cancers are caused by smoking, and about 18% are caused by a combination of lifestyle behaviors or lifestyle factors like excess body weight, alcohol consumption, poor nutrition, physical inactivity. And then there are other types of cancers that are caused by infections such as HPV or human papillomavirus, hepatitis C, hepatitis B, H. pylori, which can affect the stomach and can cause stomach cancer. And some of these things can be prevented by vaccination, for example, for HPV, by treatment or early detection for H. pylori, and for hepatitis. So there are also 5 million skin cancers that are diagnosed annually, and they can be prevented when people protect their skin from the sun and avoiding indoor tanning services. And of course, screenings. Screenings is what I'm going to delve more into because that can help prevent things like colon cancer, colorectal cancer, and cervical cancer, which oftentimes during screening or after screening, the precancerous lesions can actually be removed, like in colon cancer. When you have a colonoscopy, if you have a polyp, that's often removed during screening, which will prevent you from developing cancer. And with cervical cancer, when you have your pap smear, if it's abnormal, you can have a colposcopy, which will look closer at your cervix, and if needed, you can have a cervical resection. So there are ways screening can help to reduce the risk of cancer. And also, screening can reduce the rate of death for things like breast cancer. So when you have your mammogram, if there's something abnormal, because they caught it early, they can actually cure it oftentimes. Or with lung cancer, same thing. If it's found early, it makes a big difference because treatment is often much less intensive and easier to cure. So how do you know if you should be screened or how you should approach? So you may be listening to this and be thinking, okay, for me personally, what do I need to do now? So before we delve further into that, if you have not already, please go ahead and subscribe. This helps us get the word out so other people can learn about this information, and also share this information with other people. So some of the things I'm going to be I'm talking about, you've probably heard already, but I really think it's very important to, if you're not already doing it, then it's more than likely that you need to hear it again. So don't take it for granted, listen for things. If you have not already done it this year or you haven't done it yet, please go ahead and do it because it can make a significant difference. So how do you know if you should be screened? Well, before we talk about that, it's important to know that everyone is at risk of developing cancer. And yes, people that are older at increased risk, because 88% of people diagnosed with cancer, at least in the US, are 50 years or older. And then 57% of them are 65 or older. So yes, as we get older, there is increased risk, but everyone is at risk. There's a common misconception that only people that have a family history of cancer are at risk, and that is so not true. Genetics are important, it plays a role, but most cancers, it's important to know that most people that have cancer actually do not have a family history. So the NHS in the UK estimates that only 3 to 10% of cancers are as a result of genetics, which means 90% or more of cancers are not inherited. So while family history is important, it is not the major risk factor. There are other things that affect people's health that increases the risk for cancer. And cancer is often deadly because it doesn't cause symptoms in the early stages. And that's why screening is so important, because you could feel fine. Feeling fine is not an indication of being fine. So it's so important that our health is not taken for granted. So what can you do now? Well, I'm going to share 3 tips. The first one is be aware of what the modifiable risk factors for cancers are. So be aware of what are the things that actually increase the risk of cancer, and then do your best with them. So we know that smoking increases the risk of cancer. So if you do smoke, try to take it very seriously. Quitting is not something that should be, oh, when I feel like it. It should be something that is front and center, and you should seek help if you are having difficulty doing it on your own, because it does make a difference. Excessive alcohol intake, same thing. If you're having trouble, you're drinking more than you think you should, seek help to try to reverse that. Being overweight or obese increases the risk of cancer. So it's not just about looking good, it's also about your health. So if you are overweight or obese, it's really important to think about what you can do now to start to get towards a healthier weight, and don't, take it for granted. Also, physical activity affects that. So if you're not active, some people, are working from home now, they're sitting on their bed all day long, not getting up, not going outside. That is not a good thing. That's not good for our health. And so it's really important to try to increase physical activity. If you're not doing much right now, just making more of an effort to stand up and pace. Even if you're home, if you're already doing that, maybe walk in, just increase your physical activity the best you can. So try to keep increasing physical activity, because that does increase your risk of cancer when you're inactive. And if you need help adopting any of these healthy behaviors, or with smoking cessation, weight management, any of that stuff, reach out to a health professional, reach out to your doctor. If you're in the Texas area, reach out to us at In Touch Primary Care. Also, don't forget to use sunscreen. And this also goes for people that are darker pigmented, because skin cancer can affect brown and Black people too. So don't take that for granted. Use sunscreen to prevent skin cancer. So that's the first thing. Be aware of things that actually increase the risk of cancer, and do what you can to, avoid them or reverse them. The second thing I'll say is know thyself. So it's important to examine yourself from time to time. Make sure there isn't anything out of place. Your doctor can help, but remember, it's a partnership. Your doctor is not with you all the time. you're with your body 24/7. Look at it, find, see if there's anything out there that is out of place. If you have discomfort, don't ignore it. Mention it to your doctor. Take your body seriously. If you see something on your skin that you haven't seen before, check it out. If you see, feel something underneath your skin or in a particular body area you haven't noticed before, mention it. Don't just, ignore it and assume that when you see your doctor is going to pick it up. Just mention it, work with your doctor to help you. And I know there are some times that there might be symptoms that people have and we never know what causes it. Like, you've done all the tests, but at least you know that you've ruled out serious things. So yes, sometimes you can't get a complete answer of why something's happening, but you can still get with your doctor so they can make sure that it's not something life-threatening or serious that needs to be addressed. So that's the second thing. Now, the third thing I'm going to say is, do your checkups and your screenings routinely, typically at least every year. And as I mentioned, there are about 200 known cancer types. Unfortunately, not all of them can be screened for. Some of them we still can't detect early. So at least not yet. But the ones that we know about, we can do something about it. And finding it early makes a big difference. So during your checkups, your doctor will consider your history, and they'll look at your physical exam, do some testing if needed based on what they find. And for example, I had a patient that had abdominal discomfort, and that's what she reported on history. But when I did an exam, the discomfort was actually in the pelvis. We went ahead, we did an ultrasound, and it turned out that she had ovarian cancer after further testing. So don't take, yes, there are certain things we can screen for, but your checkups make a difference because there are other things that maybe we can't necessarily screen for yet, but there are clues in your history or your physical exam or your blood work that can help us figure out what may be happening and that can catch things early. So don't take things, your checkups for granted. So, but generally speaking, like I said, there are many different types of cancers. The ones that we commonly screen for are breast cancer, cervical cancer, colon, colorectal cancer, prostate cancer, skin cancer, lung cancer. So those are the very common ones that pretty much everybody, if you're a woman, you do the breast and cervical cancer, but everything else, everybody can get screened for. And when you get screened depends on many different factors, but generally speaking, if you're at average risk for cancer, which is majority of people, cancer screenings for women will start at age 21 with cervical cancer screening with pap smears, and then breast cancer at age 40 with mammograms, right? And then colorectal cancer screening starts at age 45 for average people at average risk. Prostate cancer screening starts at 50. But remember, these are just people at average risk. There are other things that affect the risk of cancer. For instance, your race can affect your risk for certain types of cancer. Also, your family history can also affect that, and that will determine when you should be screened. So that's why the checkups are important, because that's when we determine when you should be screened. We can find things that show up that need to be addressed. We can also let you know what vaccines that you might need that can prevent certain types of cancers, what type of blood tests. So there's a lot that goes into it. And so it's important to keep up with all those things. All right, so I hope that helped. We talked about those three things. Be aware of things that increase the risk of cancer and avoid them. Know yourself, make that effort to examine yourself from time to time, and then do your checkups and your screenings routinely, at least once a year. And if you're in the Houston area and you're looking for a doctor who is proactive about your health, you can check us out at www.intouchprimarycare.com. You can schedule a free consult or call us at 713-280-9985. And if you found this helpful, if you learned even one thing, please share it with somebody else, at least one other person, because it can make a difference for them. So many feel like they cannot do anything about cancer. They feel helpless, but research has shown that, in fact, almost half of cancers can be potentially avoidable. So imagine you decide to take charge of your health today. You start being intentional about lowering your risk. You quit smoking, you engage in healthier behaviors, you keep up with your checkups. The thing is, not only would you lower your risk for cancer, you're going to be more productive, you're going to feel better. So it's certainly worth it. So I hope that, you start thinking more seriously about preventing serious health conditions and lowering your risk for cancer. All right, that's all I have for today. And until next week, see you then.